going to hand over to Professor Diane Richardson, Professor of Sociology and Social Policy in the School of Geography, Politics and Sociology, and was part of the planning group for this event. So over to you, Diane, to set us off with a provocation.
Good morning to you all. This is a strange experience, but yesterday was very good, so hopefully we'll get through today with no hitches. I just wanted to start a little bit with my interest in these issues, which comes from my previous work on gender and sexuality, but also during the early days of the HIV and AIDS crisis with others like Sue Scott, who opened yesterday's session. And Sue was absolutely right when she said yesterday in her introduction that social sciences were absolutely key to understanding how to respond to that pandemic. And now that we're living through another one, once again, similar issues come up. It's intimately connected to gender, racial and sexual inequalities. And yet, despite that, we've been told on numerous occasions, I can't count how many times in the government's briefings over the last 3 months, that the coronavirus doesn't discriminate. Now, of course, this is erasure. We know that the conditions of vulnerability to infection, the risk factors associated with the conditions in which we live and work, the likely social and economic consequences of the pandemic, all of these things are linked to long-standing inequalities in relation to health, employment, housing, excuse me, and so on, income. And we can see from the rates of infection that the pandemic is having a disproportionate impact on BAME communities, people with disabilities and particular health conditions, the homeless, those living in more deprived areas, and so on. So while in these sessions, yesterday and today, we are focusing on the gendered dimensions of the COVID-19 crisis, it's important to acknowledge right from the start, I think, that we need to recognise the intersections with these and other forms of inequality and discrimination. Now, one of the aims in organising these sessions is to provoke questions around COVID-19 and gender, particularly in these early months. How is gender present in government and media responses to the crisis? How do responses to the pandemic reflect normative assumptions about gender, and how might that matter? And I think this is really important, what's left out of this storytelling of the impact of the virus? The data that we've got so far suggests that more men are dying from coronavirus than women. And that said, it's a much more complicated picture than this. If we look at figures from the UK published last week, it would seem that overall, there have actually been slightly more cases reported in women and significantly higher numbers of women of working age than men. And that's most likely related to the fact that women are more likely to be working in occupations that involve exposure to risk of infection. By the time we look at the older age groups, over the age of 60, the rates were higher in men. So age is a intersecting factor, as is race and ethnicity. In the UK, the number of deaths from coronavirus is disproportionate, as we know, among BAME communities, and the rate appears to be, whereas it's twice as high for men at the moment than women on average, it's over 4 times as high for BAME men, and this is parallel for BAME women as well. Now, we need a much better understanding of why COVID is affecting certain groups disproportionately, especially within BAME communities. In the case of gender, a number of possible reasons have been put forward, and they could well be intersecting factors, including genetic factors associated with the X chromosome, hormonal differences, gender differences in underlying health conditions, connected with smoking patterns and so on, and behavioural differences in risk reduction associated, for instance, with compliance with physical distancing and maintaining certain standards of hygiene. It's interesting, if you actually look at different countries, you can see that rates differ. And actually, there seems to be little or no gender difference in some places. In fact, in Canada and Finland, for example, at the moment, women are slightly higher in terms of mortality rates. And it's very early days to try and make sense of this, and it could be to do with patterns of testing as well. But what it would suggest is that our everyday gendered interactions and practices are things that we need to be thinking about. How might gender norms and gendered power relationships contribute to the risks associated with the pandemic, as we learned the lessons from HIV and AIDS? Now, in Brazil, in March, President Bolsonaro dismissed fears of the virus spreading and suggested that although vulnerable people could stay at home, others should carry on as normal. And he's been and continued to be critical of physical distancing and lockdown measures as a response to what he's described as a little flu, claiming, and I quote, "We have to face this virus like a man, damn it, not like a woman or a boy." Now, as of, it's actually another 20,000 on top of that in the last couple of days, but Brazil has the most cases globally after the US, with over 700,000 people known to be confirmed cases, although the government has actually now stopped releasing its number of confirmed cases or recording them differently, so it's hard to know the true picture. Now, of course, there are complex reasons, many complex reasons that go into rates of infection, but having a political leader who's a coronavirus denier is surely one of these. And we could, of course, look closer to home and across the pond to the US for similar examples of leadership styles in this crisis that, to me, seem to embody what some refer to as toxic masculinities, in the sense that they're harmful to both individuals, women and men, and wider societies. Resistance to risk reduction measures like physical distancing and wearing a mask, because they are not manly or perceived as a sign of weakness, is actually made all the more significant because these are very visible acts in public spheres. So gender is certainly there, all to be seen in the response to COVID-19, and it prompts a number of provocations that extend beyond those we heard yesterday. What are the frames of value that we can observe, and how might these be gendered? The issues around pregnancy and COVID have been hardly visible in the government's response. And what about challenges faced by single parents, of whom 90% are women, many of whom are on low incomes? What are the associations of risk and safety that are being reproduced in this crisis? What imaginaries of safeness are we reproducing when we tell people to stay at home? Advice that disconnects not only with those who are homeless or displaced, but are not safe where they live. At the same time, we're unclear about how we're supposed to deal with childcare issues or access to maternity, healthcare and services, or respond to the surge, in reporting of domestic violence. Yet we know that Premier League football is gearing up to return, snooker is back, and I gather there are plans to resume Test cricket. And what of sexuality? There have been pockets of concern around issues like sexual violence, the effects that are having on access to sexual and reproductive health services, implications for sex workers, and some organisations giving advice like Terence Dickens Trust about safer sex practices. And yet, despite it feeling like the elephant in the room, until very recently, there's been little reference to sexuality more broadly, despite the fact that the virus is transmitted through close physical contact. But there again, the home, the household, the family, the couple are at the centre of the government's response, the implicit focus of national struggle and images of safety. So that's some discussion of gender, but what does COVID-19 pandemic mean for gender equality? What do the answers to these and other provocations mean for thinking about how we respond to the immediate crisis and beyond? COVID-19 is a feminist issue. It throws into harsh relief old realities and long-standing inequalities and issues that have been a focus of feminist and gender research for decades. Some of these we discussed yesterday, and we'll hear others talk today about domestic abuse, possible impacts on LGBTQI populations, issues of care, and of gendered leadership in times of crisis. And there are many other issues that we could look at. For example, we know that closure of schools has a particular effect on women, as they do most of the care and unpaid work within families. Prior to the crisis, within two-parent heterosexual families in Europe, we know that women do 2 to 3 times as much unpaid care in the home as men do, a figure that's significantly higher in other parts of the world. Evidence is beginning to emerge from studies of life during lockdown that suggests that these gender differences have grown since the crisis. And here are a few examples of headline figures taken from a couple of recent reports in the UK, one published by the UK Budget Forum in April, and a survey carried out a few weeks ago by the Institute of Fiscal Studies of 5,000 heterosexual couples with school-aged children. And what they found, surprise, surprise, was that time spent on unpaid work had increased during lockdown, and that women were doing even more, though it's important to note that fathers had increased the time that they spent on childcare. They also found that of those who were in paid employment before lockdown, women were more likely to have either lost their job or quit. And in part, the explanation for this is because women are more likely to work in sectors that have been hardest hit, such as retail and hospitality, especially low-paid, young and working class women. So what of COVID-19 and beyond? Will this crisis deepen inequalities? We're already hearing predictions, and Sue discussed some of this yesterday, that women may be likely to suffer some of the worst economic effects, with greater female unemployment, detriments to women's careers, and a widening of the gender pay gap. I think it's important to note that we also come up issues of scale that we've heard before, of what counts as a crisis on a global scale, whether it be war, famine, the economy, or a public health crisis. What issues in these contexts get put on ice, get not seen as a political priority, not right now? But, trying to be positive here, echoing Sue's provocation yesterday, we might frame things differently, in shining a very harsh light on many aspects of inequality. This is also a moment of opportunity. It's a moment to set agendas, or try to set agendas, a moment of possibilities to transform gender regimes and unequal relations. We can ask, does the experience of lockdown offer a model for a better work-life balance? Might it lead us to reassess the value that should be given to care? Might some men's experience of being at home all day confronting the everyday realities of trying to juggle work, childcare and housework have any long-lasting effects? And we've already experienced some positive changes. The air is less polluted, we can hear the birds singing, and channeling Arundhati Roy, maybe, just maybe, in this atmosphere there will be more that we will come to hear.
Thank you very much indeed, Diane. And I was kind of gathering myself. Oh, yes, I'm just need to start my video. Sorry about that, everybody. Yes, I was just gathering myself to interrupt you, and I thought, no, I can hear that she's kind of gearing herself up to finish, so I don't need to interrupt you at all. So thank you so much, and that was so well argued, and so many different things that you got in there, from kind of looking absolutely at the statistics for COVID, but then moving on to a whole range of other things that we need to think about. So I'm going to put a couple of questions to you from the chat. If other people could also write in some questions as I'm doing that, that would be great, please. And some of them are comments for you to then just reflect on. Is that okay?
Yes,
and
sure.
not necessarily a question. So Janice McLaughlin, one of our colleagues, so one of the issues, I mean, I was also taken, like Janice is, by the kind of what's left out, what value, what's left out, what's risk, what's sort of what's the frame of interest and value here, and I'm quite interested in really shining a light on the things that are just simply completely ignored. Now, Janice is bringing one of them to the fore, which is disability. Disability advocates are pushing on the lack of the data being gathered on deaths, including in residential care, where the main issue has been framed as age. And there was a whole thing about toilets and toilets being locked, and I know also Janice's research is in that whole area of disability and toilet availability. And I mean, if all public toilets are locked, then there's a whole load of people that just won't be able to come out again. So I wonder if you could just comment on whether it's on disability or on other aspects that have been forgotten.
I think that's very important comment, and I know at the BSA conference there was a paper as well which raised the point that for a lot of people lockdown isn't a new experience, and that there's a knowledge base there of that isn't being tapped into as well and acknowledged. So I think it's a very helpful comment, and I've actually got I haven't had a chance to look through the public health document that's been released, but I think that is a document to actually use to see what is and isn't there in terms of what's considered and what people. It's important to, not just for what the government are doing and leaving out and the public health response, but I think it's very important for us as social scientists to actually say, you know, what areas in this scramble that there's almost been to do research isn't being done, and to start and think about that research agenda. And I think disability is key to that.
No, that's absolutely right. I mean, you're right. There has been a scrabble to do research because, you know, for a lot of us who can't do the research we were going to do, and where we have been able to raise our heads above the teaching we're doing, you know, there's been, okay, so I'll, you know, put my attention to this or this, but to find out what has been left out in that would be quite good. I wonder if you could put the link. I know a lot of us have got that document, but if you could possibly put the link in the chat later on, not so much now, but later on, that would be great, so we can follow that up. And then also the other issue that people are raising in the chat, and another issue, is to do with just a bit more on toxic masculinity in terms of, so Sue Scott is drawing our attention to Johnson's version of toxic masculinity in relation to ignoring advice and not locking down earlier has probably cost tens of thousands of lives. So it's kind of what the kind of implicit toxic masculinity has been in how our response by the government has been framed. And of course, we only have to look at the government's chief advisor for a fascinating version of that, of the enactment of those masculinities. But I wonder if there's anything else you want to say about it.
Well, and I think toxic masculinity is you know, there are criticisms one could make for that concept. I'd also want to say, if I had longer, I'd have gone into masculinity more generally, because we know the issues around HIV and AIDS, that was quite key. And I think, you know, the issue of it being in public is important, as I say, because you're actually doing, you know, Trump saying he's not going to wear a mask and so on, and you know, people continuing to shake hands and so forth. I think it's not just toxic masculinities at a political leadership level, but it's also ordinary masculinities in the sense of how some of us have been talking in everyday life about who moves on the pavement when you're someone's coming towards you, and it's age and gender, I think, that's been affected by that. So I think as we go forward and we come out of lockdown, I think, and there was some discussion yesterday about the gendered aspects of dating, for instance, and how, you know, people are going to deal with that in terms of gender scripts, which we know are linked. And we know a lot of the risk reduction research in other areas has shown how gendered this is, and in terms of how women feel able to keep themselves and others safe. So I think it would be interesting to see how those issues play out in a different pandemic, but they were certainly there when we looked at how to deal with HIV and AIDS.
Yeah, so I think, and I think the parallels you're making with HIV and AIDS is really, really helpful and really useful.
There are differences.
Yeah, absolutely, totally, absolutely get that. Yeah, but sort of drawing on that kind of history and those sociological insights and knowledges for the things we should be looking at now and things we should be thinking about now in terms of our social science is really important.
And I think that's the next phase we're going into, where we're moving into different everyday patterns of interaction, socially and sexually.
Yes, absolutely. Okay, well, I think we're going to say thank you very much indeed, and I'm going to do the normal thing I did yesterday, which I know is bizarre, but I really have to say thank you very much indeed.